So today I'm going to talk about, we have already heard a lot about like multimodal data since this morning. Then my research is definitely centering around how can we leverage this multimodal data, like human data, for different health and well-being applications. Then again, recently we have a lot of sensors, devices that allows us to monitor many different kind of human data, from behavior, physiology, genomics, biological data. So how can we leverage this data for improving health and well-being? So that is the focus of our research. So at RISE, I've been leading this computational well-being group, and we design computational methods and systems for measuring and supporting human health and well-being by designing different type of algorithms. For example, some algorithm to extract information from multimodal, multidimensional, also multi-scale data, like signal processing method. Also, how can we design not only accurate, robust, but also equitable model that works for not only specific population, but for the diverse population. So our research field has been expanding a lot from different fields, from the psychiatry, neurology, oncology, also cardiology, and other fields. And not only that, we are also interested in not just measuring people health and also predicting health condition, but also how can we close the loop? How can we provide more actionable, insightful feedback to patients and clinicians so that they can make actionable behavioral change, or they can make insightful decision making for their treatment. So, so this personalized feedback system is something we have been actually working hard to make in a real deployment. So we want to combine different sensors, again, to capture our different information. So that can capture physiological, behavioral, chemical, through like wearable sensors, a lot of questionnaires, clinical assessment, imaging, EHR, and genomics data. Then after we collect data, like interpretation is very difficult part, because we want to understand the new behavioral and physiological markers from multidimensional data. And we want to use those markers for predicting how patients will be doing in the future. And not only predicting condition, but we also hopefully want to understand what is causing which condition, then how we can intervene. So we want to connect the interpretation and inference to generating a personalized feedback. So the feedback can be generating some intervention or treatment ideas, or help clinicians, health professionals make decision. Then, so we are hoping to making this kind of closed loop system, targeting like patient, not only patient, but also people at high risk for health and health professionals. So some of our ongoing research is includes, actually these are the projects we are targeting patient population. For example, we study Alzheimer's disease patients, also their caregivers, using multimodal data, like using wearables. Also, we measure cytokine from blood intake. We also study patients with substance use disorders by integrating like imaging, wearables, and a lot of critical assessment. We also study cancer patient, also a patient with seizures. And these are all collaboration in many different institutes in TMC. And beyond patient population, we also study relatively healthy population, or also the population at the high risk for health. So we study drivers. How can we help drivers to improve their cognitive ability whenever they are feeling sleepy or tired during driving? We also study children, because a lot of children, unfortunately, they are exposed to screen use, like iPad, mobile phones for I don't know, TikToking or YouTube or a lot of videos, and how that kind of exposure to screen use impact their development, also weight, BMI status. That is one of our ongoing studies. We also study other populations like shift workers. Like even though they are not traveling, across the world, their work schedule is shifting from day to night. That's why their biological clock has been disrupted, and that has been impacting both their physical and mental health. So we are hoping to to design some system to intervene shift workers, medical professionals, also firefighters, and other population. And also students. Even though they might look like healthy, however, they are exposed to a lot of stress through their academics or research or whatever their reason. So we are also actively studying college student population as well in their physical and mental health. So in order to design the feedback loop system I mentioned to you, we have a lot of challenges we need to overcome. So these are some challenges we have been actively addressing in our current ongoing research. And these challenges in different stages from data collection. And of course, it's quite difficult to collect a lot of data accurately and also in a secure manner, but also modeling. Even though we might be able to access some amount of data, still the size of the data is limited. Also, more importantly, it's pretty difficult to get labels, accurate labels about health conditions or how they are feeling. And how can we train a robust model with limited amount of data and labels? Then feedback loop system, again, how can we design safe, reliable feedback system that works for each individual with a lot of different preferences or in different contexts. So I'd like to introduce some of our ongoing research in the next few slides. So one of the ongoing research is developing foundation model for multimodal human data. So now we can access different modality of data, imaging, note, text, time series data. Then we are in a very exciting time to design the foundation model that works for many different type of data for many different applications. So that means we don't necessarily need to design different models for different disease target. We might be able to gather a lot of data all together to make foundational model. And so we have developed some foundation models starting with some cardiology, integrating cardiology time series data, text, and potentially imaging data. That is our initial work. And so we are hoping to expand it to other domain beyond cardiology, and that's something we are currently working on. And secondly, precision health. So again, by integrating different modality of data, we are hoping to not only just predict the trajectory of disease, but also we have another opportunity to optimize, for example, treatment plan and intervention. And of course, we always need a large scale of data, and some of the data modality might be missing because sometimes, not all the data is available. So we might also need to consider how can we generate some missing data by leveraging the rest of the available data. So data generation is also one of our ongoing research. Then using these different type of data, especially recently we are combining imaging data and genomics data. We are hoping to optimize treatment plan, also trajectory prediction. And that's something we are currently working on. Then lastly, building closed loop system. So based on a lot of information about patient, again, we want to provide personalized some feedback and intervention back to patient. And then this design is not that easy because we also need to consider when is a good timing to provide this kind of intervention and what kind of format is is the best for each individual in a sustainable manner. Then one of our ongoing projects is we are designing a large language model-based chatbot for supporting mental health. And some of you might have used chatbot or LLM, large language model, for some consulting your health issues. However, we have a lot of issues in terms of safety, detecting some risky content, also personalized chatbot behavior to each individual in terms of their health conditions, also the way of communicating with chatbot. So we are currently designing novel reinforcement learning techniques to measure subtle changes in users in terms of their health conditions and also improvement, so that we can design safe and sustainable interaction between users and chatbot. Then moving forward, I am very interested in designing digital twins. So we are hoping to design some simulator that is able to imitate the behavior and physiology of human, so that we can simulate any type of patient behavior, or physiology, or a treatment plan and outcome. And so that so this digital twin is something I'm really hoping to design, especially in mental health conditions, not just beyond cardiovascular disease, which has been studied for a while. So if any of you are interested in digital twins, also multimodal modeling and intervention, please feel free to talk